Hello everyone! It is another wonderful day God hath bestowed upon us, and a great day to learn. I'm Unizel Astuanda, PSNAD student, and today we will be tackling about the major infection of STD, or sexually transmitted disease. But first, here are the learning outcomes. First is to review the major sexually transmitted diseases, classify the clinical manifestations of it, and then to determine the root causes of the major sexually transmitted disease. So, let's begin! So, as we all should know, STD is not a single disease only. There are multiple of diseases associated by various bacterial infection, parasitic infections, and viral infections. So first in the list is what we call the syphilis. Syphilis is an infection caused by Treponema pallidum. So this infection spread both horizontal and vertical. When we say horizontal spreading, it simply means that it can spread to one person to another through sexual contact. It might be vaginal, oral, or anal sex. While on the other hand, when we say vertical, it simply means from mother to child without sexual contact. To point of fact, if a pregnant woman has syphilis, the unborn child will be more likely to be born with a low birth weight, or the baby will be born too early or stillborn. Kanang pag-anak siya patay na. Untreated baby may develop some serious problems such as cataracts, deafness, seizure, or even die. So it enter in human body through minute abrasion on skin mucous membrane. And it obligates with no animal or environmental reservoir. It is only human being, us, who can get this Treponema pallidum from one person to another. So there are different stages of syphilis. So in primary stage, the infection only begins in the genitals, generally has sores. And then on the secondary stage, skin rashes, swollen limbs, nodes, and fever is seen and experienced. While on the third stage, severe medical problems can affect organs of the body. So the second one is what we call gonorrhea. It is caused by bacteria called Neisseria gonorrhea, and it spread both horizontal and vertical. It doesn't survive outside of the body, and there is a higher chance of a woman to be infected from man, which is 50%, than man becoming infected to woman, which is 20%. So these are the symptoms female may experience: abdominal pain, increased vaginal discharge, painful urination, painful intercourse, and vaginal bleeding between periods. While on the other hand, male experiences some discharge from penis, swollen testicles, painful urination, urinary tract infection, and some inflammation of the penis. So the third one is what we call herpes. It is caused by herpes simplex virus. In type 1, it can cause cold sores around the mouth, while in type 2, it can cause some genital infections. So the symptoms are painful urination, blisters and sores, fever or flu-like symptoms, skin tingling, itching and burning, rashes, and some vaginal discharge. So the fourth one is human papilloma virus. Human papilloma virus, or HPV, can cause genital warts and some cancer. There are 120 distinct types of HPV. So HPV is predominant on men more than on women, and it is easily spread from sexual skin-to-skin contact with someone who has it. You can get when your vulva, vagina, cervix, penis, or anus touches someone's genitals, mouth, and throat, usually during sex. So signs and symptoms of human papilloma virus are genital warts, precancerous lesions, lesions of upper respiratory tract, cervical cancers, and plantar warts. So the fifth one, which is the last to be discussed, is what we call HIV. This is the most common one. It is a sexually transmitted infection, but it can progress to a disease called acquired immunodeficiency syndrome, which is known as AIDS, when HIV infection is untreated. Scientists have traced the origin of HIV back to chimpanzees because they claim that chimpanzees have simian immunodeficiency virus, also known as SIV. It is more likely common to HIV because it also attacks the immune system of monkeys and apes. According to some research, SIV or simian immunodeficiency virus was probably passed to human when hunters in Africa back then hunt chimpanzee for meat. So, nakaon gurot nilang meat sa chimpanzee na infected. Or, chimps' infected blood got into the cuts or wounds of the hunters. So there are lots of myths circulating in this infection, no? So to clear things up, it is not transmitted through touching, through food, through kisses, insect bites, or even in pool. So in fact, it is transmitted through unprotected sex, drugs, blood transfusion, pregnancy, non-sterilized instruments, or any forms of bodily fluids such as blood, semen, vaginal fluids, and anal fluids, and also breast milk. So symptoms are fever, chills, headache, night sweat, sore throat, muscle aches and pain, joint pain, fatigue, swollen limbs, nodes, mainly on the neck, and then mouth ulcers.
So that's all for today. I really hope that you had learned something. Again, this is Yuna. Thank you!